When a coronavirus vaccine finally hits the market, it likely won't be available to everyone right away.
As Dr. Maria Simbra reports, there may be some groups that get priority.
When a COVID-19 vaccine becomes available, there won't be enough for everyone.
Every single American would benefit at some level from a vaccine, and I think there's no way that you can ramp up any sort of production in time to get everybody in your first pass.
The National Academies of Science, Engineering, and Medicine has devised a framework for who should get priority.
That makes a lot of sense to be proactive, to decide, if we have a limited amount of anything, who could benefit most. I think that's actually very smart that they're doing that.
In the first phase would be healthcare workers and first responders, people with medical conditions that put them at risk, including people with a body mass index of greater than 40, and people in long-term care facilities and other close quarters.
There are certain groups who are certainly at very high risk to die from COVID, and I think it makes sense that
the second phase would include essential workers, teachers and school staff, people at moderate risk, older people, the homeless, and people in group homes and prisons. Young adults and children go in the third phase.
they're not at high risk of dying from COVID if they get it. I think that might be where they're drawing the line on that.
Everyone else is in the fourth phase.
On one hand, you should say, wow, I'm really lucky that I'm not in a high-risk group. That's good for me. I think it also highlights that we're not going to be able to, easy pass our way out of this, until a vast majority of the population gets immunized with an effective vaccine.
In this priority scheme, Dr. Crawford Fauché would be one of the first to be vaccinated, but she's willing to step aside.
I'm a healthcare worker, I'm over 50, but I don't have any chronic diseases. So, I would rather, let's look at the highest risk people and vaccinate them first.
This framework is only a guide. The CDC's Advisory Committee on Immunization Practices will be doing the detailed work, and it will be on state and local officials to figure out who in their regions would fall into the priority groups. I'm Dr. Maria Simbra, KDKA News.